no, like healthcare providers don't do well in silos, and patients don't do well with healthcare providers in silos, right?
Hello and welcome to the Wellness Dojo podcast, where we bring real solutions to real health and wellness problems. Today, we're joined by Dr. Dobbyn and Dr. Riley Anderson, where we discuss how modern and traditional medicine can come together to create an optimal health experience. I hope you enjoyed this episode as much as I did. Let's get into it. All right, welcome back to the Wellness Dojo podcast. I'm so excited for this episode. Back with my man, Dr. Riley Anderson.
Back in the house.
The naturopathic ninja. And we're so excited to have our guest today, Dr. Dobbyn. Dylan is a pharmacist. PharmD, I've been told, is what it's called, his rap name.
That's pretty cool.
Yeah.
And the fact that your name's Dylan and it's like Farm D, it's just like, it's too perfect.
It works. It just works.
Yeah. Are we spitting lines today? I don't think so.
Spitting lines? No.
Okay.
I don't think so. I don't want to put
anyone to shame.
I don't want to put Farm D on the spot.
Yeah. You don't want to make other rappers jealous either. So
that's true. That's true.
Yeah.
Welcome to the show, Dylan. It's I'm happy to have you here. It's exciting for me. We've known each other for a long time, so welcome.
Yeah. I'm excited to be here. Yeah, long-time listener, first-time caller. So.
I love it. Well, we're gonna talk today about kind of these two worlds. I'm kind of sitting between these two worlds that, I kind of think, am I wrong in saying that there's been times where these two worlds have kind of butted heads, where it's like the pharmaceutical world of like the Western medicine and the natural world of natural medicine? Have they kind of butted heads? Is that fair to say?
Oh yeah.
So we're here to
needlessly.
We're here to mend some fences, but more importantly, we want the listeners, the viewers, we want to have them walk away with a little bit more of an understanding of like how these two worlds can actually kind of coexist together. I've always been the type of person who's been a little bit more weary in terms of medication, even supplements. It's like, what am I putting in my body? What's it doing to my body on the inside? And it's a very overwhelming thing. And I know there's listeners out there who feel the same way as me.
Yeah. And, these days, I think we both see respective patients who are either on medication or on supplements. And so it's really good to have a knowledge and an awareness of where that patient is coming from. And you might be surprised to know that we have maybe not quite a bit, but we have equivalent to a year's worth of training in pharmacology. And then I have not to bore anyone, a compendium of therapeutic choices, like a CTC book, and we've had to take a national exam and things like that. So I'm not, and that's because we're in a medicated world. Even though I'm a naturopathic doctor, I know that most of the people that come see me are on something, and that is the case. So I have to be aware of what they're on, and so that's kind of interesting. I don't know.
Totally, yeah. The CPS, the big red book, or I think it's blue now. Yeah.
It's
bigger than a phone book too.
Mm-hmm.
Yeah.
Yeah, it's huge. Yeah, it's big and red, but it's not jolly.
Yeah, no, not even a little bit. And it's about as entertaining as reading a phone book too. Yeah.
Fair enough. Dylan, can you tell the listeners and us just a little bit more about what exactly you do, and then we'll kind of dive into this hot topic.
Yeah, so I actually get asked what I do all the time, and I think it's always funny to try to explain it to people because I'm a pharmacist, but I actually work in the hospital. And so as soon as I tell people that, they're like, oh, you work at the Rexall in the hospital. No, I don't work in the Rexall in the hospital. I'm like, and then they say, oh, so you count the pills in the basement then? No, I don't do that either. So they're like, okay, well, what do you actually do then? Like, why are there pharmacists in the hospital? So my job is occasionally I will be down in what's called the dispensary in the basement. We will review orders that prescribers, physicians, nurse practitioners, anyone with prescribing authority in the hospital will put in. Essentially, I sit next to a big old printer and it prints off a prescription, and I will review it against people's medical charts, their online medical charts, and just make sure that the prescription looks reasonable. It's what the prescriber meant to order, clarify any issues with it, and then we will send the meds on up to the unit. And
so
then
you're basically making sure the doctor got it right, like the
exactly, yeah, exactly,
or the surgeon or whoever it might be. You're kind of double checking their work and making sure that people are actually getting what's safe.
Exactly.
Cool.
And then I also on the unit, I will round on patients myself and with the team and kind of review all of their meds and what they're in the hospital for and try to help kind of optimize the therapy they're getting to hopefully get them better, healthier, faster so they can go home because nobody really wants to see me in the hospital.
So you said to optimize the therapy, do you ever make changes to prescriptions based on your own expertise?
Yeah, absolutely. So Alberta is really, really cool for pharmacists in that we actually have, well, at least when I was in school, this was the claim, is that we have the greatest, most expanded scope for pharmacists in Northern America. And I believe actually in most of the like world where pharmacy is regulated, in that Alberta is certainly the only jurisdiction in Canada where I, as a pharmacist, can write a prescription independently of a physician. Like I don't have
Yeah.
to ask anybody's permission. I certainly do communicate with physicians when I'm prescribing medications for their patients, but I can kind of take all that lab work, all that patient data, do an assessment of the patient myself, chat with them, and then change medications as I see kind of appropriate.
Yeah. And that must be great, generally speaking, for the general public because they can go see a pharmacist. Can they, like, to refill a prescription or something like that? I remember when I've been on prescriptions, if I run out, I've had to see my doctor. This was a while back, but I've had to see my doctor, which might be 3 weeks down the line or whatever. And so now they can shortcut that a little bit, at least here, and see you. So that's great.
Yeah, absolutely. And I will shout out to pharmacists in community and in drugstores in the communities for the last 2 years have kind of been the unsung heroes because lots of physicians, especially family physicians, are just so slammed and so overwhelmed that it is hard to see somebody within, a reasonable time frame. And if you don't realize you're out of your medications until, the day before and it's a 3-week wait to see your family doctor, yeah, absolutely. Your community pharmacist is somebody that is a great person that can help you with that and can probably refill that medication for you to give you enough supply to either see your doctor or if it's a medication you've been on for forever, they might feel comfortable just giving you 3 months of it. So,
Cool. Well, now that we know that you're legit, no, I'm just kidding. No, this is that's great. It
Yeah.
gives us a better understanding, kind of what your role is in your position. But you have a wealth of knowledge around medicine. I know I've personally asked you so many questions about it at different times. So I'm just gonna jump in with the big question here: is like, where do these two worlds actually fit together? Of natural medicine and I don't know, what do you call it? Less natural medicine?
Yeah, I don't know what they call us now. They used to call it Western medicine. I don't know. There's always a different name for everything
Uh-huh.
now, but
Yeah, I hear allopathic. Have you ever heard that
yes.
one? That's an interesting one.
Yes.
Yeah, it's definitely I mean, I think it's a misnomer. People in my community think it's totally accurate because allo kind of means like other.
Yeah.
So they're like, "Oh, it's the other medicine. We're the
Yeah.
traditional. We're the real. We're the original, and they're the
Yeah.
other." So it's kind of like,
Yeah.
I don't even love that either. But
Bit of a
it's
war
the
of
term.
words.
Yeah, exactly. Yeah.
So yeah, where do these two worlds kind of fit together? I'll start first on like, in your opinion, like where is like pharmaceutical aid? Where does that fit in the best for somebody?
Yeah. So I think historically, I mean, obviously, there's lots of kind of skepticism around different types of medicine, and depending on where you land and what your experiences are, it might be aimed at different types of like one medicine versus another. And the pharmaceutical industry in general, obviously, has had a bit of a bad rap over the last couple decades. But I think like where medicines will fit in any person's life or in their kind of health and well-being is one tool that can be used in order to kind of optimize the way they're feeling, how healthy they feel, how happy they are, what they're able to do to help kind of reverse like if there are reversible causes that we address to get them back doing the things they love and feeling better. That's kind of where I feel that it can land. But again, it's one tool in a toolbox.
Mm-hmm.
And that's why in any sort of medicine, you traditionally follow like treatment algorithms where you start as least invasive as possible and escalate. So pharmaceutical intervention and different types of medication generally I would say kind of fall in the low to middle range of that invasiveness scale, depending on what the drug is and what things are. It's obviously not as invasive as something like surgery, but it's a little bit more invasive than something like, for example, massage or traditional exercise or things like that.
And like, I imagine that you guys probably do have people who come into the hospitals and are like, don't give me that poison. Like, I don't want any of that in my body. Like, how do you approach something like that with somebody who actually genuinely will benefit from this medication and they're so resistant to wanting to take it?
Totally. And that's honestly always super tough. And Riley, like, I'm sure you get this either the same side of this coin or the other side of the coin where people will say, well, oh, it's bunk or whatever. But like, I think the only way you can really address those things is to try to kind of understand where people are coming from, is what I always try to do, is like, where did that idea come from? Because a lot of people have had really negative or unfortunate experiences in the healthcare system. And maybe they were given a medication at one point or had a plan made for them that would have been a good plan, but the follow through was so poor that it just completely fell apart and failed, right? Whether that was just not enough supports in place or what. So I always try to kind of understand where they're coming from with that, and then do my best to kind of approach them with the evidence of what this is going to offer them, right? Like, I try not to say you need to take this medication because you have this disease, but I would approach it more from a perspective of, so in patients that are like you, that have, you know, similar medical conditions to you and, you know, similar health history to you, when we gave them this medication, they did better in this way, but they happen to see these side effects. So in my opinion, like, I would want to give you this medication for this benefit, whereas, and try to address these side effects if they come up, right?
Yeah.
But it's always a bit of an interesting one. Sometimes you get people who are just completely unshakable and just, no, I don't want to talk to you, and you just kind of have to respect that sometimes.
They've made their
too.
choice.
Yeah. So
Yeah, it sounds like personal experience has a lot to do with it. Like you said, like, their relationship with medicine comes from either experiences that have been passed down to them from maybe their parents or grandparents, or maybe personal experiences that they've had that have been bad, whether they had a reaction to something, or maybe they got, you know, overprescribed something and they have a bad relationship with it. And Dr. Riley, I imagine that similar things when you are approached with skepticism as well, as maybe there's somebody who's had a bad experience where either they had unrealistic expectations that were presented to them about supplements, something we've talked a lot about that expectation with supplements, or maybe somebody who, you know, really was just pushing too much, or was you know, really way far to that side of what maybe skews their image of what naturopathic medicine is. Is that something you see as well?
Oh, well, yeah. People will come to me for both of those reasons, either because they feel they've been harmed, or there's some sort of mistrust in what they call, you know, the medical system, or they were given something bogus by some holistic practitioner 20 years ago before we were regulated. And so, I empathize with both. You know, there's a wide spectrum of ways that naturopathic doctors can practice, all the way from what I would call energetic and what they call vitalism to evidence-based. And I'm an evidence-based ND. I'm called a green allopath, which is a pejorative, which is an insult to me by someone in my community on the other side. And I'm totally okay with it because I actually like the words. I like the term. Like, I'm gonna make a T-shirt now that I think of it, and a hat, and just
Let's do it.
yeah.
Let's
So
do it.
that's kind of interesting. But what I do is I have a limited amount of herbs and supplements that I use. Let's say I have a dozen, and we learned about 300. And the reason I only have a dozen is because, being evidence-based and there not being a ton of research out there, I only have so much to work with, but I do have some stuff. And I'll send you a couple studies. Maybe they've put like oral lavender oil capsules head to head with lorazepam for anxiety. And after about 6 weeks, it starts to catch up in efficacy, and then it's not quite there, but the side effects are also less, and there's no sedation.
Oh, I imagine they're significantly
Yeah,
less.
so it's like kind of a give and take. So there's pretty good stuff for like lavender oil and anxiety, for ashwagandha and reducing stress, where they're actually taking like serum cortisol measurements, and you can actually see cortisol lowering with certain herbs. But again, it takes 8 weeks. So you're talking about the patience, right? And it does. So in my world, it takes longer, and I think that's what your world can provide is immediacy. And I don't have a lot in my world that, and that's why we don't do emergency medicine. And that's why in the news, whenever we've gotten in trouble and it's become some big headline, it's because we're trying to involve ourselves in some sort of an emergency situation where we don't belong. And so I think we need to stay in our lane. Like, I definitely stay in my lane. I don't take every patient that comes to me. So it like, and I agree, just coming to them with trying to educate, trying to see where they're coming from, and then trying to educate and say, well, here's the magnitude of benefit, here's how long it's going to take, here's what you can expect, and then make them feel like it's their choice to take it.
Absolutely.
And if you make them feel like it's their choice, which it is, but not every doctor makes them, or your pharmacist makes them feel, if you make them feel like it's their choice, I find they're even more willing to trust you and then to take it.
Yeah. Is it correct to say that, like, you talk about how like there's more immediate, whereas like maybe with like pharmaceuticals you're getting a more immediate result versus like a longer kind of steady kind of approach to it? With that more immediate result, does that equal more risk typically in terms of side effects or like what it's actually doing to your body? Like, is there more risk to a more immediate result?
Yeah, it's kind of hard to quantify, I guess, because the world of like medications is so broad, and so there's so many different things. Generally, as like a good rule of thumb, yes, like if you are like acutely, we would say, like perturbing or manipulating something that you're like a bodily system or process, the faster you do that and the greater degree to which you do that is definitely associated with more risk, which is why you kind of see, not only for convenience but also for speed and potency, you would see like typically people take oral medications in community. Obviously there's a huge convenience piece there, but then as they get to hospital and they get like very acutely sick, and we're maybe not exactly sure what's going on and we need to do things really quickly, then we go straight to IV, right? We put it right in the blood, which is obviously like faster and more potent and things like that. But I am glad, Dr. Riley, you brought up kind of the timeline of things, and specifically that example of like mental health, because I think a lot of people, because of the way medications have been used in the past, kind of expect that really quick result. And in some cases we can give them that, right? Like in emergency medicine, we can do things very quickly. And even in things like blood pressure, like if I gave you a blood pressure medication, an hour later we could reasonably expect your blood pressure to be lower. But specifically with mood and mood disorders and anxiety and depression, typically we can manage the symptoms of those things really quickly, but it comes with a lot of sedation. But those treatments are much more, even like from a medication standpoint, in, I don't know what we're calling it, allopathic medicine, conventional medicine, I don't know. Whatever they're going to call like pharmacotherapy now.
PharmD.
Yeah, exactly. The best timeline we can get on, real effective change for mood is typically 4 to 6 weeks, up to 8 weeks. And that's on a therapy that someone responds to, right?
Yeah.
And it may take them 2 or 3 different tries to find a medication or, group of medications that works for them. So that can be very disheartening, I think, for anybody, especially because at that point they've probably tried different things. They've tried natural remedies, they've tried, exercise, they've tried, vitamin D therapy or like sunlight, or, like people are trying really hard to kind of change the way they're feeling. And if everything we're looking at is on a scale of like 4 to 8 weeks, it can be really disheartening for some people, I think. And that's why I think, that's where I think you can lose a lot of, not necessarily buy-in, but it's hard for people to commit to something for 4 to 8 weeks when they're feeling unwell. So,
And when they expect like an immediate fix, right? Like I think that's an important thing for us to talk about as well. Is we talk about, like, for example, blood pressure medication, right? Somebody's gonna start blood pressure medication. Maybe they had something with their heart, and they're gonna be presented with this medication. They're gonna go, great, now I'm on this medication for life, right? Because they think like, well, this is the fix. Like, I had this problem, I had this incident, and now this is the medication that fixes it. Like, what role, I mean, I think I know the answer to this, but I'm curious what you think. Like, what role does the medication play versus what role does like a more long-term strategy, like maybe some naturopathic medicine approaches, but also like just like standard exercise and diet? Like, what role does that play compared to the medicine for people who feel like they're staring down just like this second half of life now that's just medicated?
mm-hmm. I'm really glad you asked me that, because there's some really, really cool evidence there. And it's easy to get caught up in kind of like the medicalization of things, especially after something is significant and is kind of scary and severe as a heart attack, where we kind of look at it on a spectrum. So a lot of people will, get a diagnosis of high blood pressure or high cholesterol, or maybe pre-diabetes, or like a diagnosis of like actual diabetes, realized diabetes. And they'll get started on these medications and they'll think, okay, well, that's it. Like, I'm medication dependent now. But there is actually some really, really interesting data that's actually now getting even a little bit older. It's not like it's even cutting edge. But specifically with diabetes, that we did a randomized controlled trial where we compared metformin, which is like your classic first-line diabetes drug. Lots of you, I guarantee you know someone who's taking metformin.
Yeah. Or Ozempic.
Or Ozempic, yeah, everyone loves Ozempic now. But they looked at metformin versus a diet and exercise regimen, and it wasn't a strenuous diet and exercise regimen either. I think the exercise piece of it was 150 minutes a week split over, I think, 3 to 5 days. So 30 to 50 minutes a day, 3 to 5 days a week. And they looked at the progression of someone who was classified as pre-diabetes to actual, like, full-on diabetes. And they found that the diet and exercise group did better. Less of them went on to have diabetes than the people who was actually being treated for diabetes, which is really, really cool, because there's not a lot of places that we can point to where we can say with really strong evidence that, like, you can do better if you can stick to like a good lifestyle intervention. You can get a better response than starting on a medication, right? There's a reason medications kind of fall halfway up the algorithm, is because they're more invasive, but they're also typically more potent. Whereas in this case, the metformin group still did work. Like, less people went on to develop full diabetes than doing nothing. But it was actually inferior to exercise, which is really, really cool. Yeah. But then again, to put it on that spectrum, once you've had diabetes and you have, maybe moderate to severe diabetes, and you're starting to have what we would call the vascular complications of diabetes. So you're starting to have troubles with your eyesight, troubles with your kidneys, maybe you're starting to develop heart disease, things like that. That's where exercise is still important at preventing that progression, and we still do see significant benefit in just overall patient health from exercise. But in terms of managing that diabetes and bringing it back down to a level where it's no longer doing active harm to you, we see we can't do it with exercise and lifestyle alone. You need interventions like metformin or like Ozempic. Everybody loves Ozempic right now because it comes with lots of weight loss. So yeah, so everybody's trying to get on it. I think it just went short in the States because the Kardashians started it for some weight loss thing. Yeah, but yeah, so I like to think of it as like a spectrum, and that's why we have a toolbox of things. And early intervention is always kind of lifestyle intervention, and in some cases it is so potently effective, which is really, really cool.
Yeah, we try to be what I call like proactive health. And it would be just so awesome if one day we would be welcomed into the trusted network of primary care, because that is what we do, and what we try to do is we try to intervene early and get people set up with good habits and good lifestyle factors. And what would actually happen if we were allowed to do that is we would relieve such a burden on the healthcare system that it would be unbelievable. But here's the conspiracy: do they want that?
Yeah, I
Does the
mean,
government want that?
yeah, I mean, it's like from what I'm hearing from both of you is that there is a place for these things to work together. Like it's not. I think oftentimes people think that it's like it's either medicine or it's exercise and diet, right? But
Absolutely.
it's like there's a place where you can use both, and there's a place where it sounds like both can really benefit when used together the right way. Because like when you were talking, I immediately thought of certain people will probably benefit from like a phase almost of like, okay, we're going to start you on this phase of this medication so that we can get you to a normal level where we can then like continue to monitor it with a healthy lifestyle and with these other interventions. And mental health is a big one, right?
Mm-hmm.
Because
Mm-hmm.
some of the medications, I mean, I'm not well versed on medications and symptoms and stuff, but I do know that some of the medications for mental health that people are using are extremely addictive medications, right? And so like finding ways that people can maybe have trusted support of, like two practitioners like yourselves who are, working together and saying, okay, let's start you with this kind of more potent start so that you can get
Mm-hmm.
things under control. But in the meantime, we also want to start using some of these other things that are going to be a little bit more of a long-term solution,
Mm-hmm.
but something that you can fall back on so you're not on this medication for the rest of your life and dependent on it.
Mm-hmm.
And it would be nice if you could combine a little bit of naturopathic medicine to be able to reduce the dosage of what the person needs.
Mm-hmm.
Again, it's like about, not only timing but also severity.
Mm.
I find that most of the studies for things that we have are low to moderate depression. We don't talk about severe depression very often in my world. That's a co-management case type of scenario. But a couple things come to mind that we call augmentation therapies. So, first of all, we have to be very aware of anything that increases serotonin levels or anything like that, because you risk serotonin syndrome. So, like rhodiola is something that can increase serotonin levels. So, anytime someone's on an SSRI, which is an antidepressant, I can't give them that herb. Or St. John's wort, which can be
Yes.
used as a standalone therapy in low to moderate depression, particularly low, I would say. But so I can't combine certain things that are at my disposal. I can't combine if they're on an SSRI, but there's some things I can use too that are starting to emerge. So one example is actually curcumin. There's some studies, particularly with depression, with curcumin, and the theory is that because it crosses the blood-brain barrier, if there's any type of neuroinflammation, maybe because of like chronic stress or a heightened HPA, like a stress response, there could be or like lots of childhood trauma or something like that. There could be neuroinflammation, and that's hypothesized that can help with depression, and it doesn't interact with any medication. So that's one. And the other that's starting to emerge that honestly I haven't prescribed very much, but it's saffron. And saffron, I don't know if it's the extract, but it's something like 15 milligrams to 30 milligrams daily is an augmentation therapy for mental health that's helping. So it would be nice if that could happen, then we could intervene before someone has to go on like Abilify and kind of like another prescription drug, because some people that works, and then I see the other side of it where people come to me and said that made me suicidal. I've never been more depressed in my whole life. I can't believe the doctor gave me that. And yeah, what can you give me? So
Yeah.
kind of thing. So there's really great opportunity here, and with good quality RCTs behind it, especially for curcumin. I'm gonna send you at least a few examples after this, and you can review it with all that spare time I'm sure you
Yes.
have.
And I think you raised a really good point there too. Kind of a little bit back before we moved on to this is kind of being brought into the fold. And I think it's really important. Like no, like healthcare providers don't do well in silos, and patients don't do well with healthcare providers in silos, right? And like from with your education, you have a lot more in-depth understanding of the level of evidence behind each of these different things, whereas physicians, I know, don't get a ton of complementary or like alternative therapeutic education. And even from a pharmacy perspective, we do get a little bit more of it just because we're the people they typically ask about all the drug interactions. So we get a
Right.
little bit more of it, but even then it's very bare bones, and it's very like, okay, here's your natural medicines database, like you can look it
Yeah.
up basically.
Yeah.
So I think like that's a really important piece, is like those treatment plans shouldn't exist in silos, right? And we shouldn't, I think a lot of times patients feel like they have to choose between one or the other, and they feel like, someone's gonna, especially with like professional egos in medicine and healthcare are quite famous. I don't know if we have to go too far down there, but
Tell us how you really feel.
yeah, exactly. All healthcare providers are prone to it. I won't single anybody out, but yeah. So I think like anytime like there's a treatment plan involved, especially with complex patients who are on different medications or who have different health limitations or anything like that, I think it's important that people are able to be transparent and like share those assessments with each other. And then like, hey, I was thinking of doing this. Do you anticipate any, concerns with this? Like, do you feel like this will cause any problems? Do you think this is the best way to do this? Okay, if that, then what if we did it this way instead? You know what I mean? And I
Mm-hmm.
think that just builds better care in general, because you kind of wrap patients in resources then where
Yeah.
they feel supported.
Yeah, and I think that's the biggest problem. At least I know I felt that way, and almost everybody that I've ever talked to feels that way as well. Is they feel like, I'm just gonna pick on the Western medicine, but like they feel like they go to the doctor and it's like, I've tried this, this, and this, and these are my issues, these are my concerns, and it's like, okay, well, I want you to take this for 6 weeks, and then if it doesn't improve, come and see us.
Yeah.
It's like, so they feel like they've just been kind of like handed off, right? And what they really would appreciate is going, okay, who's your physiotherapist?
Mm-hmm.
Let me reach out to them. Let me see what they're. Who's your naturopathic doctor? Let
Mm-hmm.
me reach out to them. Let me see what supplements you've tried, and let's see how we can come up with a plan that works for you. The problem is, like you said, I think doctors' offices are so busy, and they're probably doing okay without reaching out to those teams. The patients don't feel like they're actually getting taken care of. They don't feel like they are the priority, when the reality is we all get into, whether it's me getting into fitness and massage early on in my career, or whether it's you getting into pharmaceuticals and hospital work, whether it's you getting into naturopathic medicine, we all got into it for one reason, and that's because we wanted to help people. But then it
Absolutely.
doesn't seem to translate across, because like you said, like credit to what both of you said, it's so like sanctioned, it seems, of like, nope, this is my thing, and like you're gonna try this, and I'm not gonna communicate with the other side, right? It's a problem for the patient. It is.
Mm-hmm. Yeah, and each side's kind of there's wounds
Mm-hmm.
on each side too. Like like I know from us, we've made so many mistakes. Like we've got hubris too, being like, we have the solutions, and we have different medicine that no one else has, and like a lot of that stuff that is part of our roots has been shown to not be efficacious.
Yeah.
And so and I know we've talked about this before, like my opinion of who are the good naturopaths. It's like those who are able to drop what has been proven to not work and keep what has been proven to work. And it's like relieving that, like, it cuts the stuff down by like the options of what to give someone by like 90%,
Yeah. Yeah.
and yeah. So hey, maybe we'll start a big summit one day. They'll
Yeah.
be bigger than the G20, and we'll we'll try to, because that would be amazing. And in British Columbia, the naturopaths there can work with pharmacists to compound herbs and pharmaceuticals, because they can actually prescribe. We can't prescribe here in Alberta. I have to take the exams and all that, like I mentioned earlier. But in BC, they can. So there's some really cool stuff happening where they say, okay, like if someone's being prescribed, I don't know, like HRT, hormone replacement therapy, they can add some sort of an herb or some sort of a vitamin or mineral, if it all works together, and compound it and give that to the patient. So there is some of this happening in Canada right now, just not exactly where we're at.
How much is like personal self research? How much does that affect what you guys do? Like if you have people who come in and they're like, no, I researched this medication, or no, I researched this supplement and it's dangerous, right? When really maybe it's not. Like how much does that come into play with you both?
I mean, I graduated into the pandemic with COVID evidence or lack thereof evolving seemingly overnight. So much, I will say, especially when it comes to COVID specifically. But also with just everything else, right? People typically don't seek out healthcare until they've exhausted what they feel they can do, right? Like you don't, especially I just feel like people don't tend to reach out for help until they've tried to solve the problem themselves. So usually people will come to you and say like, I think it was this and I did this, this, and this.
Yeah.
And it may actually, sometimes they bang on, they've got the problem right, and they just didn't have the resources or access to the right, tools or treatment plans to treat it on their own. And sometimes they were maybe on the right track, but just needed, like, it needs to be explored and investigated further, right, to figure out what the actual problem is. But yeah, so much of a lot of my job, actually parts of my favorite parts of my job are chatting with people about what do you think is going on and what do you want to do about it? And here's what I can offer you. And I have, maybe 3 or 4 options if I'm lucky. Sometimes I maybe only have one, which always sucks. But I'm like, these are the different options I can offer you. This is what I hope they will do for you. These are the bad things that might happen, but I'm hoping we can minimize those risks. What do you think about it?
Yeah.
And that's some of the favorite conversations I've had throughout my job are those, because everybody has always done their homework when they come to you. And assuming that they haven't is always, I think, to their detriment. So
Yeah, and I would say, just before I throw it to you, Dr. Riley, like that's something that, I respect you so much for, and something I think that you are so good at with your patients is like you listen to everybody first and prescribe second, right?
yeah.
And I think that's just so important, is that patients come to people, and sounds like same with you, Dylan, that people come to you and they feel heard and they feel like their opinion does matter, but it shows empathy when you listen first and prescribe second, whereas like I mentioned before previously, I think a lot of people do run into that experience, probably both with going to their doctors and with their naturopathic doctors, of saying, this is what's going on. They're like, oh, great, try this.
yeah.
On to the next patient, right? So
Yeah, I'm pretty lucky because we're basically privatized healthcare, and so I get to spend like 60 to 70 minutes with the person.
Yeah.
And that's a huge privilege for them, obviously, but also for me too. And what's really cool is it comes through in, like, someone will drop me a Google review and I'll hear that in their review, and I'll be like, oh, good. Okay, good. It's not all in my head that I think I'm hearing people out there. I'm like, it's actually happening. And yeah, people, the reason why they're putting that in the reviews because they really appreciate it and they don't feel heard these days, you know? So
it's important to people.
Yeah. It's really important to establish trust. It's everyone wins when you establish trust.
Yeah.
You win, they win. Yeah. So it's something that you have to learn how to do.
Yeah.
And like learning to listen is a big part of it. And I'm also pretty lucky because, I'm independent and I can kind of do what I want. I'm not worried about churning people in and out of clinic doors to pay the rent and stuff like that. So I'm lucky in that regard too, as I can be kind of that genuine person that's I do like house calls and things like that. I'm old school.
Yeah.
Do you have the bag?
I
The
do.
doctor's bag?
Yeah,
I love that.
I don't.
Yeah.
I don't have the creepy bird mask.
Good, good. Yeah, we're not that far into the plague yet. Yeah.
Perfect.
Yeah.
I do want to go a little bit deeper on mental health because that's something that was brought up, and I think, just given the state of the world the last few years, there's so many people that are dealing with mental health in terms of anxiety and depression, those two things kind of mixing together. Can we talk just a little bit about some ways that people can go about treating their mental health conditions? Maybe first from both of you, kind of what are some of the biggest things that you guys are seeing people come in with your patients, and then we can get into kind of how can people kind of treat this in a way that is safe and healthy and effective long term for people. I don't know who wants to start, but
Yeah, go ahead, man.
I kind of explained my role in the hospital earlier, but when I'm on the unit, I'm on the internal medicine unit. So what that means is we typically get patients who are a little bit more medically complicated, maybe a little bit more severely ill, not so ill that they need like intensive care, but definitely that they probably can't go home because of whatever they're in hospital for. Not that a lot of people in hospital could just walk out the doors and go home if they felt like it, but
yeah.
they really need to be there essentially. And a lot of like when we get people in, a lot of it is sequelae or consequences of unmanaged mental illness, and a lot of that shows up in the form of substance misuse or overdoses, things like that. And those are the ones I always really struggle with because we kind of just, because we're an acute care center and because we just don't have the ability to hold on to people long term in order to kind of keep them in hospital, we kind of have to patch them up and then set them up with a few resources as best we can and then move them to someone else. So I always kind of struggle with that.
What would be an example of like somebody who's coming in like what you're describing right now?
Lots of alcohol withdrawal and lots of liver and kidney issues and all of the things that go with heavy alcohol use.
So, sorry, you're seeing like the long-term effects of untreated mental health.
Exactly.
Yeah.
Yes. And we do bring in the psychiatrists. I mean, anyone who's there with, any sort of mental health history or who asks for mental health, who tells us they're struggling, we do try to make sure they see a psychiatrist before they go home. But oftentimes it's hard because they're usually delirious or, some combination thereof. They're withdrawing from substances. For people struggling with mental health, I would say the biggest thing you can do is really be aware of your substance use. And
Could you please repeat the question, sir?
Yeah, absolutely. So essentially what we're looking for here is, what are some of the biggest things that you're seeing patients come in with mental health,
Yeah.
and how do we treat that in a safe and effective long-term way?
Yeah. So I guess just first of all about like staying in my lane. We don't treat severe psychosis, schizophrenia. We're supposed to co-manage even bipolar disorder, borderline personality disorder, things like that. But what I see a lot these days is what I would call an intolerance to distress. And people do not have the tools when they start feeling distressed, when they start feeling uncomfortable, it starts to snowball. Their blood pressure raises, they start to feel uncomfortable, they get more distressed, and it just goes and goes and goes until it might turn into a panic attack or something like that. And so these days I see a lot of that, and what I try to do is distress tolerance training. And so just trying to make people aware that just because you're uncomfortable or you have uncomfortable thoughts or feelings, you can retune, you can try to be present. There's certain cognitive strategies, there's certain like biofeedback strategies just with the breath that can bring you down from a 7 to a 9 to a cool 7 or 7.5 that, and then maybe from there you can maintain that control. Yeah, there's this wonderful concept called thinking traps that I definitely did not come up with, but we do have counseling under our scope of practice, so I get to use some of this stuff. And I just created a really awesome handout because I found there were several resources out there and they were kind of outlining the thinking traps, but not really saying what to do.
Mm.
And so, with the thinking traps, so one would be catastrophizing, which is assuming the worst case scenario is going to happen, regardless of its probability. And people start to, that becomes a habit in people's thinking, and they just start to go, oh my goodness, like I'm not going to get this job, and I'm gonna lose my house, and I'm gonna be like on the street, and oh my goodness, da, da, da. And they're doing this like in the middle of the night or
So,
as they're trying to fall asleep, and then that creates like more stress the next day, and it just kind of has horrible downstream effects. So what I try to do, and notice I'm not talking about any supplements, right?
yeah.
So try to hey, take a look at these thinking traps. Do you do any of them? Great. Take some relief that you're not alone. These 20 or whatever have been outlined because human beings do this stuff. And then there's something called a rational counter statement to each of these thinking traps too. And so you can practice like, okay, I'm just catastrophizing. Okay, and then you have kind of this script that you tell yourself as well. You combine it with some breathing. Maybe you grab onto something literally to ground you. And so that's what I see, because I don't see a lot of the severe psychosis, but I do see a lot of anxiety, it leading into what I would call, some mania and some panic. So I still think that like cognitive strategies and grounding and presence is great. There's all sorts of supplements and things you can take to calm down your nervous system, but that's more so the training that I'm doing with people.
Yeah. And it sounds like you guys are pretty aligned in that, because correct me if I'm wrong, but that's sounded like kind of where you were going with your thought process, as well as like people, like the number one thing that they can do is have awareness of, first of all, what their mental health is, but then also like how are you coping with it right now. And what came to mind when you were when you started talking about that is, you hear people who are, had another stressful day at work, glass of wine.
Mm-hmm.
Had another stressful day at work, glass of wine. Soon that turns into 2 glasses of wine a night, and can very easily become a slippery slope, of coping mechanisms, right?
Yeah, yeah, absolutely. And I think Riley touched on it really, really nicely. Is we need to kind of wrap people in services and the ability to recognize those things that are detrimental, right? Like recognizing those thought patterns, those kind of negative feedback loops that we all get into sometimes, and kind of interrupting them, and building tools for people to help recognize and minimize and address those things. And like what you're kind of describing is like the word I hear thrown around in the hospital all the time and by colleagues in social work and things is cognitive behavioral therapy and different types of counseling and things like that. Those are excellent ways to intervene in those areas. And one of the ways that we know is really evidence-based for helping people address their mental health is just finding a therapeutic relationship, right? Having a therapeutic relationship with someone who has that kind of training and is, facilitating that kind of role for you we know is effective at improving people's mood and reducing, depression, anxiety, all those things. And kind of like what you said and touched on is with the, had a rough day, had a glass of wine. I will say, like, I mean, you've known me for a long time. I like to have a beer after work and go out and have some fun. But if you are struggling with your mental health and finding that you're kind of going in a direction that you don't want, or you find that you're struggling with coping, sometimes one of the hardest things you can do is to kind of reduce your alcohol intake, or reduce those coping mechanisms that you're already relying on. But ultimately, that's going to be one of the most important things you can do, because those things will always interrupt those things will always kind of perpetuate those negative feedback loops.
Yeah.
So to kind of build those supports around people, to give them those tools, and give them those therapeutic relationships and help them kind of build those strategies is so important.
Yeah, I mean, there's a lot that we're talking about today that's outside of my scope, but that's one of the things that I do believe is in my scope, and something that I do see with people is, helping people just be more mindful and find an awareness to like, how are these things actually making you feel, right? And that's something that I can attest to, where I've had times where my anxiety's higher, where I'm feeling more depressed lately, or those types of things, and I really notice that when I have a drink, even one drink, that's like all of a sudden I'm starting to feel like way more anxious than I normally would. And it's like recognizing that in certain times it's not a good idea for me to be drinking or coping with alcohol because it's actually making it worse right now. But then there's other times where I'm not as stressed, not as anxious, not as depressed, and the alcohol doesn't affect me as much, right? Because people need to realize that when we're looking at mental health, and it's often a building thing, right? It's like pressure that's being stacked. I mean, you guys correct me if I'm wrong here, but it's often pressure that's being stacked, and then it's like eventually you get to this bursting point, right?
Absolutely.
Yeah, and I mean, I've experienced it. I've had panic attacks, and
Yeah.
mostly school driven, but
Yeah.
but yeah, but so everyone experiences that differently. I've also experienced it, independent of studies and things like that, and it feels like that. It does. It's like the kettle boiling, and eventually it just boils, and
Screams.
you freak out.
Yeah.
You freak out either outwardly or you go
Inwardly.
completely inwardly. Yeah.
Both dangerous, yeah. And Dylan, something that you touched on that I just think is so important, and I think we've touched on it a few times, but to kind of wrap it in a pretty bow with that is like you mentioned having that network of support. And I think that really just brings this whole conversation together of, you guys aren't working against each other. Like you guys are on the same team. And the more that us health practitioners, regardless of the degree, the certification, whatever, whether you're a personal trainer or whether you're a doctor, the more that we can start to work together. And, I'll stand up for the personal trainers out there. It's like, it's so easy for a doctor to dismiss a personal trainer or a massage therapist or something, and even a naturopathic doctor, right? Because it's like, well, you don't have the same level of education or the same degree as me or whatever the case might be. It's like, yeah, but I know this person. Like I have clients that I know that client better than their doctor knows them. Like I know the ins and outs of that person because they tell me everything, and I care about them deeply and all these things. Building a relationship and being willing to step outside of maybe the realm of normal and say, hey, I'm going to actually talk to this person about this client because they might know something I don't know that might actually help me treat them better. Right? I think it's just so important.
Yeah.
And that's the whole reason I wanted to do this episode too. Is just like there's this disconnect in our world, I believe, of, in particular with this episode is talking about pharmaceuticals versus more natural approaches. There's a disconnect, but the disconnect doesn't have to be there, and it can really, really help if it's not, I think.
Yeah, I agree. Save the fighting for Twitter.
Yeah,
right.
yeah, exactly.
That's
yeah.
right. Yeah, take it out on the Twitter.
Yeah.
Anything that we haven't talked about that you guys want to make sure that we do touch on here?
No.
We've talked about quite a bit.
We covered a lot of topics. Yeah.
I think I think this will be a really impactful episode. If you're listening or watching and this has been an impactful episode, like let us know like what resonated with you, what stood out to you, what questions do you still have, and maybe there's space for us to come back and answer some more questions from listeners and viewers.
Yeah, there we go. Yeah, it's always better to work together and to cooperate. That's who we are as a species, and there's so much disconnect right now and so much separation, and oh my goodness. And it's something that we need to all work on going forward, especially after what we went through.
Yeah,
absolutely.
Yeah, there's a lot of healing to go through, and it'll, happen step by step, but let's all do our part any way that we can.
Yeah, and us practitioners all need to stick together to help build that trust in our communities, right?
Absolutely. Like you said, we're all on the patient's team, right? It's easy to get caught up in the job and what you're doing and what your role is, but we're all on the team patient at the end of the day. So
yeah. Awesome. Well, I really enjoyed this episode. It's so great to have, we didn't even mention the fact that you're also a black belt of the same academy as us. I can't believe I didn't mention that off the top, but yeah, we're all black belts under Grandmaster Jess Kung. So shout out to Grandmaster Jess. And yeah, this was fun. It was fun to get the black belts together. We're all ninjas.
Yeah.
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 So
that's awesome.
yeah, awesome. Thank you guys for listening and watching. Dr. Dylan Dobbyn, thanks for being here.
Thank you.
Thanks.
D
Really,
Farm.
yeah, really appreciate you being here. Farm D.
Farm D.
Farm D. All right, we will see you all in the next episode. For additional support or to work with one of us one-on-one, go to our website, www.wellnessdojo.ca. You can also find us on Instagram at wellnessdojoyyc or on all other social media platforms searching The Wellness Dojo. We'll see you in the next episode.